Good morning, everyone. Dr. Owens, Chiropractic of Bellevue. And today I want to show you a great little technique I learned and that I used myself to keep the shoulders, pain-free, keep them mobile, and help you before your workouts, after the workouts. And all you need is a little stretchy band. And you can use any kind of stretchy band that you like. The exercise is called stretchy band, dislocates. And what we're doing is we are going to work the shoulder through a range of motion where it's tight. Because we seldom move the shoulder back. We're always forward, doing computer work or working on stuff. To keep the shoulders healthy, we have to stretch them backwards, which stretches the pecs, but also work the joint capsule in the posterior or back aspect of the shoulder capsule. So that's what we're doing here. We're just mobilizing it. I suggest 10 to 15 times, and as you work that, you can feel it, and you'll start to get a little lactic acid burn. That's good. It's doing what it should do. Don't get too crazy with it. When you start out, what's nice about the stretchy band is that it'll accommodate with you a little bit. So you can start out, if you can only go to here, keep your arms locked. If you can only go to here, great. Work that motion. As you become more flexible, you can choke in on the band a little bit more, get a little better stretch as it goes over that. I'm Dr. Owens. Use this to help your life. Good afternoon, everyone. I'm Dr. Owens here at Chiropractic of Bellevue. Today I'm going to go over one of the ways that we treat a common source of low back pain and show you how it works and how we fix it. So we look down here at the spine. A lot of times low back pain is generated by the bones being jammed upwards here, or there's pressure in the very center. And this would be pain in the small of the back right here as the belt line comes across right there in the small of the back. You have kind of an achiness or even sharp pains in there. So what we would want to do first, of course, would be to adjust that joint or get it moving, restore the normal joint biomechanics and movement. And so since we've got too much compression there, we want to take the arthrostem here, adjust upwards, and then we come downwards while we apply a traction force here to open it up here. Once that joint motion is restored, the second thing that I like to do is take the vertebral distraction pump, which does a little opening. We actually can open those joints up with the pump there. And so after we've mobilized the joint or got the bone moving better, we can come in here and apply some distraction. We'll put the patient in a slight flexion, but we come in here and we can open those joints up. And when that does that, we restore the motion and the ability to restore the flexibility in these joints, and it relieves that aching, boring pain that comes from injuries to that area. So those are just a couple of the ways that we can work on your lower back pain if you're having it. Feel free to give us a call. I'm Dr. Owens, Chiropractic.
Dr. Owens, I was wondering, do you recommend any kind of pillow for people with neck pain or sleeping problems?
Pillows are very individualistic. However, I'm doing some testing right now with some different pillows. There's some new ones on the market that I really like. One of them is this. A lot of people have trouble with their heads getting really hot, myself included. The ventilated pillow, this is all a nice memory foam, but it's got air holes so that it keeps it cool. The other one is a compartmented pillow, and that will hold up to a lot of different types of bodies. Good morning, everyone. Dr. Owens, Chiropractic of Bellevue. Hope you're having a great day. I wanted to show you a few quick things you can do for your low back while you're sitting all day at work. There's a couple of really great stretches that will stretch the hips, the glutes, and keep pressure off that sciatic nerve as it goes down the leg. The first one, you can just do this while you're sitting right at work, is you will spread your legs apart as far as you can. Keep the lower leg fairly parallel to each other, and as you keep your back fairly straight, you arch forward and push out. As you arch forward and push out, you're going to do this in 1-second pulses, I like to say. It's better than just sitting there and holding it. You can hold it, but it's a little better for the body if you pulse forward and then come out of it and relax. Pulse forward, come out of it and relax. You're going to do that for about 12 to 15 times or until the area feels nice and warm. Now this one you should feel in the hip joints itself. Good afternoon, everyone. I'm Dr. Owens, Chiropractic of Bellevue. Hope you're having a great day today. Here at the office, one of the ways we use to rehabilitate lower backs is a device called the wobble chair. And the wobble chair it's meant to bend and flex and move back and forth. One of the characteristics of discs is that to remain healthy, these are filled with water on a healthy disc. They need to flex and move, and with this movement it brings water and helps the disc stay healthy. The water is pulled in. So Dr. Pettibon invented the wobble chair, and in order to simulate that movement, and all you do is you get on it and you spend 5 to 10 minutes wobbling on the chair, making the chair move back and forth, forward and backwards. As it moves forward and backwards, pulling nice, healthy nutrients into the disc, pumping waste products out. And a lot of patients really love this. And you just get on the chair and you work it, you work circles, and it's super effective for maintaining young, healthy discs for a long, healthy life. Thank you. I'm Dr. Owens. Have a great day.
Hey, Dr. Owens, I heard about hyperflexion. What is that?
Hyperflexion typically happens in a car accident when you're rear-ended or maybe you hit something, but it can also happen on a fall or when you fall forward, or a snowboarding accident where your head, but to define the term, is where your head, flexion is where your head moves forward. Hyper, of course, is too much flexion. As the hyperflexion occurs, things can tear. Here we can have ligaments that tear. We've talked about this in some of our other videos, but also you can have severe hyperflexion. You can even cause vertebrae to fracture. So hyperflexion is typically accompanied by trauma and definitely needs the proper care. Hey guys, Dr. Owens here. I'm here with a patient, Chloe, and I just wanted to show you one of the things that we can do with your shoulders, especially for someone who has chronic shoulder problems, issues where uncomfortable cracking and popping occurs. One of the procedures we do in this clinic is a procedure called kinesiotaping. Skin up allows fluid to flow through the subcutaneous space, allowing the joints to heal. It also brings up nervous system awareness of these joints, so the joints move freer and smoother. Every time the patient moves the joint, it's actually causing a healing action. We taped her scapular muscles here, where a lot of people have pain in between the shoulder blades. This can help support that. We did the trap muscle. Those upper traps can get really tight and are involved in the whole shoulder girdle scapular complex. And then we did a basic deltoid taping, where we tape the outer edges of the deltoid here and then a support strip up the middle. Pretty thorough shoulder taping job. I just wanted to show you it is within the scope of some of the things that we do. So, whether it's a simple problem or whether it's a really complex problem, we can help you out. All right, have a great day, and Dr. Owens, we'll love to see you soon.